Mitchell.
Hello.
Your name's Mitchell, right?
Yes.
Sorry. I'm Tamara.
Hello, Tamara.
I'm a family nurse practitioner student at Indiana State University, and we're going to do a quick health history.
Okay.
Okay? Is it all right if I call you Mitchell?
Yes.
Or do you have another name?
Mitchell's fine.
Mitchell. Okay. All right. The first thing I want to do, it's a pretty simple, it's just called the mini mental exam. We do it to make sure you're oriented. And what is today?
Today is February 12th, 2022.
Perfect. Where are you at?
I'm currently at my sister's house in Provo, Utah.
Cool. Okay, I'm going to say 3 words, and then I'm going to give you a simple task to do, and then I'll have you repeat the 3 words, okay?
Okay.
Okay, ball.
Ball.
Sock.
Sock.
Jazz.
Jazz.
Okay, I would like you to take this piece of paper and draw a clock on that, a face of a clock.
Okay.
Do you need something to write on? Or something hard? Okay.
Right here. So draw a clock?
Yep.
Okay, drawing a clock. Okay. Does it matter?
And if you want to make it say 5 o'clock, that would be great.
Okay. All right, there we go.
Okay, and then make it say, did we say 5 o'clock?
Yes.
Perfect. Okay, and then if you could repeat those 3 words to me.
Ball, sock, and jazz.
Perfect. All right. That's our mini mental exam. It orients you to person, place, and time. And you did a simple task and you remembered 3 words. So thank you for that.
Awesome.
You said that today is February 12th, 2022. You are a male. Is that what you identify with?
Yes.
Okay. How old are you?
33.
33. Okay. What do you do for a living?
I'm a salesperson for a telecommunications company.
Okay. Are you married?
Yes.
How long have you been married?
11 years in 11 years in May.
Awesome. Do you guys have any children?
One.
One. Boy or girl?
Girl. 5 years old.
5 years old. Exciting. Okay, I'm going to write down that the source of reliability is the patient. You're self-reporting this. And what would you say your chief complaint is? Like, what concerns you most about your health?
General anxiety.
General anxiety. Okay, how do you treat that? Are you on medication? Are you in therapy?
I'm in therapy. I don't have any specific medications for anxiety, but I take Adderall, which helps kind of compartmentalize a lot of that.
Okay. How long have you been on the Adderall?
Probably a year now, or 2 years actually. 2 years.
What is your dose of that?
Currently, I'm prescribed 30, but I cut it in half and just take 15.
Do you take that once a day?
Once a day, but generally just as needed recently.
Okay. And when you say just as needed, do you determine if it's needed or did your doctor prescribe it that way?
The doctor, he prescribed it for twice a day, but he told me that I could just take it as needed. So I don't need to take it twice a day unless I need to. So.
Okay. All right, and how do you determine when you take it?
A lot of it is if I have a lot of things at work to do, or if I need to, if something I'm doing requires a lot of focus. That's usually how I determine that.
Okay. Okay, so your history of your anxiety, when did it start?
It's pretty cloudy, but probably around the age of 10 or 11,
right.
as far back as I can remember.
Did you have any treatment for it then as a child? Okay. So it started when you were about 10 years old. No treatment. Was there no treatment because they were unaware, or because you just didn't think you needed it, or your parents?
I just didn't. I thought it was normal, so I didn't really. I just thought that's how people behaved, so I didn't really express those feelings or anything like that. So.
Oh, all right. Has your anxiety gotten worse as of late?
It's gotten a lot worse, especially in the last 4 or 5 years. So.
What's made it get worse?
Generally, I think it's because I'm getting older, and I know that those can exacerbate and get worse as I get older. And then just a lot of anxiety around my daughter, those types of things. She's been sick with asthma symptoms, those types of things, so it's been kind of difficult having to deal with that.
That can be very stressful.
Mm-hmm.
That's true. What do you do to treat your anxiety? How do you take care of it?
A lot of just coping mechanisms, like 4-square breathing, or naming the 50 states and their capitals, or playing a video game that requires just a lot of concentration.
Okay.
Is what I've seen help.
And I think I asked a few minutes ago, are you in therapy for it?
Yes.
Is that helping?
Yes, very much so.
Good. Okay. All right. Do you have any risk factors that you think increased your anxiety or caused it or anything like that?
Risk factors, no. It's just kind of something that's, I don't know if I want to say organically, but it's just kind of something that's just happened. Or just, it's been there and it's just gotten worse. So.
Okay, it's just gotten worse. And you said that's because of your daughter being sick with asthma?
Yeah.
Okay. When you have an anxiety attack, what is your response to it? How does it affect your life?
I kind of just freeze up. I don't do it's just very, I kind of just, I don't shut down, but I'm very irrational, and I get upset and angry. I don't lash out, or I'm not violent, but I'm very difficult to deal with. So it's just more of like anger, those types of things.
Okay. Medications, we talked about the Adderall earlier. Mm-hmm. Any other medications?
No medications, no.
Any supplements or any over-the-counter things?
I'm taking something called ashwagandha.
Ashwagandha, I've never heard of that.
I haven't either until this
Sounds like something the Avengers would take. And
just,
what is it? What is that?
It's just, it's like a stress reliever supplement. My wife looked it up because to kind of help with my anxiety, to see if there was something out there, and she found a lot of people were taking this. They'd had some good results, so I'm just kind of trying it out.
How often do you take it?
It says 3 times a day, but I was doing usually twice a day, usually midday and at night.
Does it seem to have made a difference?
I think it's helping curb the Adderall side effects, which one of them is I'm a little more aggro.
When you say aggro, what does that mean?
Like irritability, those. So I'm just really irritable and those types of things. So it kind of helps curb that a little bit, so I'm not so aggro.
All right. Well, I'm glad you found that. Then now, does your therapist know you're taking that?
Yes. Mm-hmm.
Okay. Do you have a provider that knows you're taking that or anything?
No.
I don't know how to respond.
Okay. Okay. Do you have a regular provider?
I have a doctor for my Adderall, but if that's what you mean, yeah.
Okay. Does your doctor know you're taking it?
No. Usually, I only meet with him when I need a refill for my other medications. So.
It might be smart to let him know you're taking that as well.
For sure.
Do you have any allergies?
Not that I'm aware of. Probably just general allergies, like hay fever, those types of things.
Okay.
Sinus infections.
All right. Now this question kind of has some little steps to it. Do you have any tobacco use, smoking cigarettes?
No.
Do you vape?
No.
Very good. Very good. Do you, and you don't chew tobacco? Do you chew tobacco? Okay. Okay. Now, all right. Do you drink any alcohol?
Occasionally, like maybe once a week, once every 2 weeks. Not really often at all.
Okay. Just once a week. Do you ever get drunk?
I get buzzed, tipsy.
How often do you do that?
Not very, like every few months maybe, if that.
Okay. You don't drive when you're
No.
drinking or anything. Okay, that's good. How would you explain your general health in one word?
In one word, healthy question mark.
Why the question mark?
I mean, I know I'm a little overweight for my size, and I don't exercise often. Don't really watch what I eat, so. But I mean, I don't really have any detrimental effects to that, so. just kind of like there's things I could be doing, but I'm not.
Okay. All right. Did you have any childhood illnesses?
Not that I'm aware of.
Did you ever have? You said you're about 30. You're 33. Did you ever have chicken pox?
I think so.
Okay. Do you know if you're current on your immunizations?
Yes. Yeah.
And did you get COVID vaccine?
And boosted. Yep.
Nice. Okay. Very good. Okay. Never had. Well, if you have your vaccines, you never had measles or rubella or anything like that.
Nope.
Okay. Did you ever have a lot of sore throats or?
Not really. That I can recall. I mean, I would just get the normal like sinus infection, so drainage would just cause the sore throats, those types of things.
Okay. Now your daughter has asthma. Did you have asthma?
I believe so. I think I grew out of it.
Okay. Does anyone else in your family have
I think
asthma?
my father had it, and he grew out of it as well. And my sister has it. She has asthma.
Okay. So it kind of might be running in the family.
Yeah.
Okay. Are you diabetic?
No.
Is anyone in your family diabetic?
I think my father's pre-diabetic, and my grandfather was diabetic.
Okay.
On his dad was diabetic.
So your dad's dad.
Yeah.
Okay. So that, just so you're aware of that, you'll need to watch your diet. Be aware of that a little bit. We talked about asthma. Your daughter has asthma. You think you did as a child?
I believe so. I think so. Yeah.
Okay.
I think I don't remember.
Any hospitalizations?
Nope. Mm-mm.
Well, that's good. So you're healthy, question mark. That's kind of working well for you there,
For the
isn't
most
it?
part, yeah.
Any accidents or injuries?
No, none that were kind of things that I would recall or anything like that.
Okay. What are your sexual practices?
Normal.
Normal. Just one partner?
Just one partner, yeah.
Okay. Okay, no risk for HIV?
Nope.
All right. Let me see here, because we talked about your immunizations.
Mm-hmm.
Tetanus. You're 33. Tetanus is one vaccine that you get. Sometimes you need a booster if you've like a rusty nail or a cut from something. Do you know if you're current on that?
No, I don't think so.
Okay. You might want to check and get a booster on that. You just have one sexual partner. We talked about that. Well, we asked about that. If there's anything you're uncomfortable talking about, you can just say, can we please skip that? That's okay.
For sure.
If you want, then we can skip over it. Any mental illnesses in your family or for you personally? We talked about anxiety.
Yeah.
You. Any depression?
Depression, pretty sure anxiety. My father is bipolar, I think. Yeah, probably just the...
Do you suffer from depression?
Yes, related to my ADHD.
Okay. I do have this little questionnaire, if you don't mind, at the very end of our little meeting. We did our mini mental exam, but if you want to fill this out, it's a PHQ-9. It's just a depression scale.
Sure.
Have you, in the last 2 weeks, felt worried, overly anxious, or anything like that?
Yeah, I've had some pretty gnarly anxiety the last 2 weeks.
What has caused that? Do you know?
Just related to my daughter's asthma.
Okay.
So she, may or may not have had, well, she didn't, but just had a coughing episode, but it was just related to just good old mucus stuff.
Mucus?
So.
Over the past 2 weeks, have you been able to stop or control your worrying?
No. So, I mean, given a couple of days I can, but there probably was a few bouts in there, a few days where I couldn't. So it was just something I was dealing with and having to work through every day.
Does that go back to your daughter's coughing and her asthma and her sickness?
Well, it's a whole thing, but yeah, that's a trigger for it, and then it just kind of dissolves from there, so to speak.
Okay, and you're in therapy for that, and you're working it.
Yep.
Do you exercise a lot?
No.
No. Exercise can help with depression.
Mm-hmm.
Do you get outside? I know you said you are a telesalesman, right?
Yep. Mm-hmm.
So do you get outside much?
No, just with it being cold. I don't really get outside that often, no.
Okay, because you can, if you get some good vitamin D, get some sunlight when it's warmer. Walks are really good for depression. But I'm sure you're working with that with your therapist and stuff, so that's a good thing. Over the past few weeks, have you had any anxiety attacks? We've talked about that.
We talked about one, but I've had a few the last couple weeks, so still the same thing, just daughter coughing, those types of things.
And you're aware of that, and you're working on it.
Working the best.
Okay. Well, if you could fill this out, then at the end, that would be great.
For sure.
And we can kind of give you a little score on that, but it sounds like you're working on that with your anxiety and therapist. Do you know if have you had any screenings done for your cholesterol or anything like that?
No, never actually. Not that I can, or at least not that I remember. So.
Okay. Be aware that you're about that age, and diabetes runs in your family, so that might be a good thing to do. Have you ever had your stools? This is a funny question we ask. Have you ever had your stools checked for your bowel movements checked for blood or anything like that? Are they a good color, like a peanut butter color, or are they dark brown or anything?
Yeah, nothing to really write home about.
Okay, do you have any constipation or diarrhea?
No, not really. I mean, I have upset stomach from time to time, which kind of can cause some problems, but other than that, not really.
Okay. All right. When was your last physical with your provider?
The one I remember actually. So I was going to say when I was married, but it was actually probably like a year or so ago now that I think about it.
Okay.
So they just kind of did a once over on me.
Now, I know you mentioned earlier that you are worried about your weight. Did they talk about your weight at all there?
Not really. We asked I had some back issues that we asked about my weight in regards to that, and they said it had nothing to do with that. So.
Okay. When you say back issues, what's wrong with your back?
Pretty gnarly lower back pain. I haven't thrown my back out for a while, but usually when I throw it out, I'm down for a couple of days. So it's been like that for a number of years now. So.
Okay. So when have you last been to the dentist?
When I got a root canal to put a crown in, which was probably like 3 or 4 years ago.
Okay, you have good dental hygiene, flossing, brush your teeth.
Yeah.
All right. Your vision, I can see you wear glasses.
Mm-hmm.
You had your vision checked in the last little while?
I haven't for a while. I got this prescription I got these glasses last year. Didn't change my prescription. So last time I actually got it looked at was probably January of 2020. So 2 years now.
Okay, and I know that you said that you work on the computer a lot at home.
Mm-hmm.
Do you have a blue light lens in your lenses?
These ones, no, just for cost reasons, but I have had them in the past.
Okay.
I think when I get a new pair, I'll get the blue tint on.
I know that can help.
For sure.
So, hearing. Are you hard of hearing or? Okay, good. Okay, we're going to go over your family history a little bit. Okay. Your mom and dad, your siblings. Any health concerns with your parents, grandparents? Any cancer, stroke?
Cancer, no. Stroke, no. I think my grandmother had breast cancer.
On your mom's side or dad's side?
Father's side. But general cancers, strokes, no, nothing.
How old was she when she had breast cancer?
70s, I think. I don't know. I was pretty young when it happened.
Okay, and what about heart attacks?
My grandfather on my mother's side, I think he's had 2 or 3. One when he was vacationing, and then one just a few years ago.
Do you know how old he was?
I think he was in his 70s as well.
Okay.
Because he's in his 80s now.
Okay.
Actually, I don't really remember.
Do you have high blood pressure?
I did at one point. It's pretty normal now.
That's good. Were you on medication for it?
No,
or?
I think maybe it had been related to stress, but I don't. It just they said they were worried about it at one point, and then it just kind of normalized, and we haven't had to worry about it since. So. Oh,
that's good. Okay. Does anyone else in your family have high blood pressure?
Not that I'm aware of. So.
Okay.
I don't know.
All right. So we're going to go over a few little things here about your family and your grandparents. We've talked about the high blood pressure. You had some, but now it's resolved, and you think that was stress related. Was there something in your life going on at that time?
I think it was school stuff. Just trying to get done with school, just general life type of things.
Were you in college?
Yeah.
How much school have you finished?
Bachelor's degree.
Oh, nice. What is your bachelor's degree in?
Political science, emphasis in American government.
Ooh, that's interesting. Cool. Okay. Coronary artery disease, that has a little bit to do with the, I just forgot the word for myself. Cholesterol levels and things like that. Does that run in your family at all? Your grandfather had a heart attack, but
I haven't really,
in a stint.
We haven't really heard of anything like that. So.
Okay. Anyone in your family have a stroke?
No, not that I know of.
Does anyone in your family have diabetes?
My father, I think, is pre-diabetic. My grandfather had diabetes. His dad had diabetes.
So, do you know that puts you at risk for diabetes?
Yeah.
Okay, so just be aware of that in your life. What about thyroid disease?
No, none that I know of.
Okay. Kidney and liver disease in your family at all?
Nothing that I'm aware of. That probably really bad at not knowing those things. But no, I have no idea.
Okay, arthritis?
Also don't know, but no one's ever complained about any of these things, so that's why I'm not sure.
Tuberculosis?
No.
No. Okay. Have you had a TB test done ever?
No. At least not to my knowledge.
Okay. Usually they do that when you're traveling or something, or some healthcare jobs or something, so you might not know, but if you ever get a chance, that might be something for you to follow up on. Asthma and lung disease. Now we know that you had asthma as a child and outgrew it. Your dad had asthma as a child, and your daughter has asthma. How are you treating her asthma?
We have a nebulizer with a big old box of albuterol, and then just kind of general, just watching her, seeing where she's at.
Okay.
Those types of things.
Any seizure disorders?
No.
Well, good. You guys are not doing too bad here. What about mental illnesses? Depression?
Yeah, depression, anxiety. I think my father's bipolar. Those types of things.
What makes you think your dad's bipolar?
He has medication for it.
He has medication for it, so he probably is bipolar?
Yeah.
And then depression. Do you suffer from depression?
Yes.
In addition with your... Are you on any medication for it?
No.
Do you feel like you need to be or want to be?
My Adderall usually takes care of a lot of those symptoms because it's related to my ADHD, so when I'm on it kind of goes away. So.
Okay. And what was the dosage from your Adderall? Did I ask you that?
Yes, it was 30.
Oh, it was 30 milligrams twice a day,
but
right?
I cut it in half, take 15 once a day whenever needed. So.
Okay. And you feel like that takes care of it?
Yeah.
All right.
Does a pretty good job.
All right. And then we did talk about exercising and vitamin D for your depression.
Yep.
And you're in therapy for that when you need to?
Yep.
All right. Well, that's good. That's good. What are some of the coping mechanisms you have for your anxiety and depression?
Just the 4 square breathing, high concentration on like a video game or something. Wife comes and talks to me about something random. Those types of things.
Okay. Do you have any thoughts about suicide or anything like that?
No suicidal thoughts, but suicidal ideation, more in range with just when I'm in an anxiety attack, like my brain going, how do we stop this? It's like, oh, if you weren't here, you wouldn't have this. But no serious thoughts. It's more of just me trying to rationalize what's going on to try to calm myself down. But no suicidal thoughts.
Is your therapist aware
Yes.
of these thoughts you have? Do you talk to your wife about it at all?
Yeah.
Okay, so everyone's aware. You have a good support group
for sure.
that?
Yeah.
Okay. Substance abuse. Any alcohol, drugs?
Nope.
Okay, no substance abuse.
No, I'm pretty try to keep pretty close aware of those types of things, but nothing, no red flags in any way.
Okay. We talked about allergies. You just have hay fever. No allergies to medications or anything?
Not that I'm aware of, no.
Okay. Any cancer? You said your grandmother had cancer when she was breast cancer when she was in her 70s. Any others?
None that I'm aware of, so no.
Okay. Obesity.
Overweight, but
Any sickle cell anemia in your family?
No.
Okay. Any other sicknesses that you would know of on your mom or dad's side?
No, nothing that I could think of.
Okay. A social history for yourself. How would you define your personality?
Extrovert, introvert, extroverted with people I know, introverted with people I don't. It's related to my ADHD.
So kind of shy and...
Yeah, just people I'm comfortable with situations.
Okay. What are some of your interests?
Guitar playing, music, fantasy novels, video games, lots of cool stuff.
Nice. What kind of music do you like?
Metal.
Metal.
Metalcore.
All right.
Metalcore.
Cool. What are your support services?
I have my wife, family,
Sources.
friends. I can call up my friends anytime I need to. My wife's always there. Family's there. So.
And you can be honest with them about your feelings when you're having some of those struggles with your anxiety.
They, especially with my friends, they go through a lot of the same struggles, so we kind of identify with each other on a lot of that stuff.
Okay, good. Now, your coping style, we talked about your 4 square breathing and your video games. Anything else you do?
50. I named the 50 states and their capitals.
How does that help you?
It just helps distract me from what's going on. Try to break the cycle. Because you have to concentrate and think about it. So.
Okay.
Anything requires.
And do you feel like that breaks the cycle for you, and then you can?
It gets me to a rational level, which then over time helps me get down to a 1 instead of a 10 or a 5.
Okay. What do you like your anxiety level to be, where you can function and be rational on the scale of 1 to 10?
I mean, 1 is the is the preferred, but usually 4 or 5 is probably the best because then I can just be rational and all that good stuff.
4 or 5 is good for you. How high does it get on a scale of 1 to 10? And when it's at a 10, you do some of the breathing exercises and stuff?
Try to. Mm-hmm.
What are the triggers when that happens?
Recently it's been my daughter coughing. But that's really just been the main one recently. But bad news is for anybody can be a trigger.
And I'm sure, did it seem to get worse with COVID and everything, the pandemic and the masks?
For sure. Masks not so much, but just COVID in general. So.
Okay. All right. Well, it sounds like you've got some support with that, and you're working with your therapist, and you've got things a level that you know you want it to be at. So that's good. That's good. What are some of your strengths?
Pretty resilient. At least I think I'm pretty resilient. Curious. I like to figure things out. Don't like to kind of dismiss things. I kind of want to understand things better. So curiosity is a big one. And then I just roll with the punches. I think that's just resiliency. So I just kind of one step in front of the other, I guess would be honest.
You just keep going. Just get it done.
Just keep moving.
Good. Okay. What are some of your fears?
Being alone, death, those types of things. Probably normal stuff. Being alone's a big one.
Okay. We talked about your occupation. Mm-hmm. We know that you have a bachelor's degree because that came up already. Mm-hmm. Your significant others. We've talked about your wife and your daughter who's 5 years old. Your friends. Mm-hmm. Sources of stress. COVID-19. Mm-hmm. Marriage.
Marriage. This is more normal marriage stuff.
Your daughter's asthma.
Daughter. General health. Yeah.
Okay. What? Do you have a religious preference?
No.
Okay. What are some of your lifestyle habits, exercising and things like that?
No exercise because it's cold. I've been generally just staying inside, but try to drink a lot of water. I don't know if that could be a thing.
Okay, what do you drink? What's your diet like?
It's food. So I eat eggs every morning.
Okay.
So eggs with potatoes and ham. Recently took cheese out of it.
Do you have a lot of vegetables, fresh fruit?
Not really. No, just I only eat maybe twice a day though, and I've limited my snacking, so
okay.
I only eat twice a day. So.
What's your caffeine intake?
Probably an energy drink it's an energy drink every day. Just one.
Just one. Keep it to one, but if you can cut that out, that might be good. Do you wear a seatbelt when you drive?
Yep.
Do you text when you drive?
Try not to, but
Good.
Gotta
Good.
answer. But
Do you wear sunblock?
only when I'm at the pool.
Okay.
So.
All right. Any alternative health practices?
Nope, nothing out of the ordinary, but
Just the little ashwagandha?
ashwagandha.
I'm going to have to look that up. Okay. We're going to do a quick review of systems.
Mm-hmm.
Your skin. Any skin tags? Eczema, dry skin?
I have some skin tags. I got one here. I think I have psoriasis or something under my eye. But I've been using a lotion that's kind of gotten it under control. But it was pretty bad at one point. I pulled it, just scratching, and I cut my eye open. My eye open. But the lotion helps with that.
Are your eyes, are they dry? Do they
Dry.
moist,
Yeah.
dry eyes? Do you use any eye drops for that?
No, I probably should, but I live in a really dry area, so.
Any drainage from your ears? Any ringing in your ears?
Nope.
What about your throat? Is it dry, scratchy, anything like that?
It's scratchy right now just because need some water.
Winter?
Generally speaking, it's okay.
Okay. Anything in your neck? Any swelling in your neck or anything?
No.
This is a personal question for men. Any pain in your breasts?
No.
Okay. Do you get shortness of breath? You said that you live at the top
Just going
floor.
up the stairs. That's really the only time it's an issue.
Okay.
So.
Do you feel any heart palpitations, a rushing heartbeat, or a pounding heart?
Just during anxiety attacks or stuff like that. So.
Do you have diarrhea or constipation a lot?
Not really. Just like I kind of stomach aches, but I think that's just gas. So.
Okay. Any urinary problems?
Not really. No.
Okay. Do you have any spider veins or?
No spider veins. Nothing like that.
Do you feel like you have good circulation in your feet? Do they ever get cold?
Not really. Feel
Okay.
Feel pretty
Good. Any weakness in your legs, arms, your grip?
Nope.
You mentioned lower back pain before.
Mm-hmm.
Is that the only thing there?
Yeah, it's improved quite a bit recently just because I have some things to help with the tightness in my back, tightness in the muscles. So.
Okay. We've talked about your depression and your anxiety. Neurologically, you passed the mini mental exam, so that was good. You remembered the 3 words. Any blood disorders?
No.
Any?
Nothing like that, no.
No bleeding if you get cut or anything like that?
Nope.
Energy level, that do you ever get fatigued, really tired,
just at
lethargic?
Just at night, or if I have a bad night's sleep, then yeah, but nothing out of the ordinary.
Okay. Okay, if you could, I handed you that paper for a depression questionnaire.
Mm-hmm.
It's called the PHQ-9. If you want to fill that out when we're done, that would be great.
For sure.
I'm going to list your chief complaint as anxiety.
Cool.
And depression. And we've talked about that quite a bit. You have a therapist to help you with that.
Mm-hmm.
We talked about substance abuse. You're okay with that?
Yep.
Don't have any problems with that. Said you're being careful with it. And no alcoholism.
Nope.
Just drink it once a week.
Yep.
So, all right. Well, I want to thank you for doing this with me. I appreciate it. If you want to fill that out.
For sure.
We did talk about the depression a little bit.
Mm-hmm.
So, thank you for doing this with me.
Thank you.
Okay. Have a great night.
You too.